All right. Today we're going to talk about a condition that's, well, pretty widely misunderstood, rheumatoid arthritis. And I'm telling you, it is so much more than just joint pain. Its first signals can be incredibly subtle, popping up in places you would never ever expect. So let's dive in.
I mean, seriously, think about it. For most of us, right, you probably picture wear and tear. Maybe an older person with stiff, sore joints, something that just seems to come with getting older. But what if I told you that, when it comes to rheumatoid arthritis, that whole picture is almost completely wrong?
Okay, so this is where everything you thought you knew about arthritis kind of gets turned upside down. RA isn't caused by wear and tear at all. It's actually an autoimmune disease. And it doesn't just stick to the joints. Nope, it's systemic, which means it can impact your entire body. And maybe the biggest shocker, it can show up at literally any age.
That phrase right there, systemic autoimmune condition, that is the key to understanding all of this. See, autoimmune means your own immune system gets confused and starts attacking your healthy cells by mistake. And systemic means that attack isn't just in one place. It can happen pretty much anywhere in your body. And that creates this widespread inflammation that's the root cause of all these different symptoms. So, okay, if this inflammation is happening pretty much everywhere, where does it actually, show up? Well, let's start with the surprising external signs, the clues you can actually see.
Yep, we're talking about signs on your skin, in your eyes, and mouth. And, believe it or not, it can even mess with your hearing, all places you'd probably never connect with arthritis. This is a perfect example of how an internal problem suddenly becomes an external one. When RA causes inflammation in your tiny blood vessels, that's a condition called vasculitis, it can literally show up on your skin. You might see rashes, notice you're bruising easily, or even find these firm lumps called nodules, which tend to form near your joints.
And the attack doesn't just stop at the skin. RA often brings a friend to the party, another autoimmune issue called Sjogren's syndrome, which goes after the glands that make moisture. The result? You get these persistently dry, gritty, irritated eyes and a really dry mouth. And look, that's not just annoying. It can lead to some serious problems like cavities and gum disease.
But what you can see on the outside, that's really just the tip of the iceberg. The effects of RA go so much deeper. So now, let's look at the internal battle that's going on, where this disease can have its most serious impact.
Yeah, that same systemic inflammation we've been talking about, it can go after some of our most vital organs, from our lungs and heart all the way to our nerves, bones, and even our digestive system.
Okay, this next part is super important to be aware of. That inflammation can actually target the delicate lining around your lungs, that's called pleuritis, or the little sac that surrounds your heart, which is known as pericarditis. And that can lead to things like a chronic cough, shortness of breath, or even short chest pains. Seriously, if you're feeling this, it is not something you just ignore.
So what about the structural damage, the impact on your body's framework? Well, all that inflammation can cause swelling that actually starts to press on your nerves, and that's what leads to that classic pins and needles feeling, a lot of times in your hands or feet. But it goes deeper. Over the long haul, that same inflammation can mess with how your body builds and maintains bone, which can lead to osteoporosis and a much, much higher risk of fracture.
All right, now let's talk about something that can be the absolute hardest part of this disease, the symptoms that nobody else can see. These are the invisible signals that take a massive toll on a person's quality of life.
I mean, we are talking about a deep, crushing fatigue, low-grade fevers that just hang around, losing weight without trying to, and of course, huge impacts on your sleep and your mood. It's so important to get that these aren't just in your head. They are real, physical symptoms, and they're a direct result of the disease itself.
And when we say fatigue, let's be really clear. This isn't just, oh, I'm a little tired today. This is a bone-deep, can't-get-out-of-bed exhaustion that a good night's sleep just doesn't fix. Just try to imagine your body being in a constant low-level war with itself 24/7. That's what this inflammation is, and it just drains a tremendous amount of energy.
And it just becomes this awful, vicious cycle, The constant pain from the inflammation makes it almost impossible to get good, restful sleep. Then, of course, not sleeping makes the pain and the fatigue even worse. When you're living with that kind of physical burden day in and day out, it's totally understandable that it takes a huge toll on your mental health. It's exactly why anxiety and depression are so much more common in people with RA.
Okay, so with all these crazy symptoms, right? From your skin to your heart to how you're feeling, how in the world do you connect all these dots and actually figure out what's going on?
So the first thing, and this is absolutely critical, is to understand the difference between RA and the much more common osteoarthritis, or OA. They are just fundamentally different things. OA is mechanical. It's that wear and tear on your cartilage that happens slowly over time. RA, on the other hand, is that autoimmune disease, that systemic inflammation that can hit you really suddenly at any age.
And here's something else that makes RA so tricky to pin down. The symptoms are not always there. They tend to come in waves. You have these periods of really intense symptoms, those are called flares, and then they're followed by periods of remission, where you might actually feel a lot better. This up and down roller coaster is exactly why it's so important to keep track of your symptoms, even the weird ones, so you can give your doctor the complete picture.
So, getting a diagnosis, it's not like there's one single test that says, yep, you have it. It's really a process of putting puzzle pieces together. A doctor is going to do a physical exam, looking for swollen joints. They'll run blood tests to look for certain inflammatory markers, and they might use imaging like X-rays or an MRI to get a good look at what's happening inside the joints.
You know, this quote really says it all. It's the perfect way to wrap this up. Rheumatoid arthritis is more than just joint pain. It's a systemic condition affecting many body parts. That's the whole story right there. Recognizing that this thing is a full body issue is the absolute most important step to getting the right diagnosis and the right help.
So I guess we'll just leave you with this question to think about. Your body is always communicating with you. Sometimes it's a whisper, sometimes it's a scream. The key is to listen to all of it, even the strange unexpected signals, because they just might be part of a much bigger story. Thanks for listening.